Hello, I'm Adam Giragosian. This is Nicole Kajuse, Kadiatu Fafana, and Josephine Twom. We are doing a presentation on deep vein thrombosis. This is for our evidence-based practice 2 class.
Okay, and I'm going to be talking about the patho. So what is a deep vein thrombosis? It's also known as a DVT, and it's also referred to as a venous thromboembolism, which is a blood clot or thrombus, which occurs in a large deep vein, usually in the legs or pelvic area or groin. So we have a case study that we did with patient X, who presented to the operating room with a broken femur from work. Patient X is a 56-year-old white male with a history of smoking and alcoholism. He's overweight, has high blood pressure, and high cholesterol. Patient X is on lisinopril for his high blood pressure and Lipitor for high cholesterol. He is rushed to the OR for emergency surgery. An explanation of the procedure is given to the patient by the surgeon, which consent was signed. These are his vital signs in stage 1 in the operating room. He's having repair of the right fractured femur. His temperature is 98.5. 89 is his heart rate. His O2 sat is 97%. His blood pressure is a little high, 155/90. His respirations are 20. He's prepped for surgery, and he states that he's feeling a little nervous. So we've come up with some interventions for patient X, preoperative. So we want to ensure patient safety. First of all, his airway for anesthesia. We put TED hose bilaterally and SCDs. He's positioned for surgery and keeping in mind to avoid reverse Trendelenburg. According to Blake, Toker, and Dunn, the reverse Trendelenburg position decreases femoral blood flow by as much as 42%. Now, Adam will ask you some questions regarding stage 1.
So for the first question, we want to ask the class, what factors place patient X at risk for developing a DVT?
He's overweight, smoking, alcoholism. Most importantly, he's going for surgery of the fractured right femur, long bone.
What were the preventative measures in the preoperative phase for DVT prophylaxis?
TED hose, SCDs, proper positioning for blood flow.
Very good. So for one, patient X presented with a long bone fracture. So long bone fractures have the highest risk for developing of a DVT. There's also a history of smoking, a sedentary lifestyle, alcoholism, his fact that he's overweight, he has hypertension. Those all, and the fact that he's going under anesthesia for surgery, they all correlate in having risk factors for a DVT. So the preventative prophylaxis stage for pre-op were the SCDs and TED hose, and also proper positioning. So Kadiatu is going to introduce us to stage 2.
All right. Patient X came to recovery room after surgery, and the nurse performed initial assessments and noted that the patient's right leg was larger than the left leg, about 4 centimeters larger. So there was tenderness, pain, swelling, and some redness. And the vital signs for this patient is 99.0 for temperature, pulse 95, and blood pressure was low, 88/60. Oxygen saturation is about 95%, and respirations were 25. And these are just some of the tools that are used to diagnose a blood clot. So DVT and physician orders. Blood was D-dimer to diagnose blood, to measure the substance that's released as the blood clot dissolves, and Doppler of the extremity, a venography It's where they use a liquid dye to detect blood clots, and it's one of the most accurate tool that's used to diagnose DVT. It's also one of the most uncomfortable method used to diagnose. And they also can use a it's a simple CT scan that they could use also to diagnose a blood clot. Another tool that's been used to diagnose a DVT is also the magnetic resonance venography, and this is also one of the accurate methods. It's non-invasive, so these are all the tools that are used. The MRV method is mostly used for people that have allergies to dye, so they're not gonna be allergic if use that method. And this is just the stage 2 interventions for this patient X. The doctor was notified about the patient change of status and the symptoms that the patient had presented to the recovery room. The doctor gave orders for the D-dimer, ultrasound of the extremity, the CT scan, and the MRV. And also the nurse got more information. They got a PTT, to see where the patients how thin their blood is. They measure their weight. They started a heparin drip for this patient to try to resolve this problem for the patient. And now I'm gonna have Adam ask the questions.
So for the stage 2, I have the first question, and it is what manifestations did patient X present with for us to give him this diagnosis of a DVT besides our lab tests?
Pain, swelling.
Pain,
Okay.
swelling,
So the changes of the
changes
calf
of the
size,
calf
redness,
size,
pain,
4
swelling.
centimeter, yeah.
Okay. So the second question is, what initial lab work should be done? Should the doctor include?
PTT,
PT.
PT, yeah, INR,
So we'd probably get a CBC,
CBC,
and H&H.
yeah.
So for the first answer, there's shortness of breath, increased swelling of the right calf, pain and tenderness, also with the swelling for the first answer. And for the second answer was PTT, INR. So we're getting a complete CBC of what his blood is looking like. So I'm going to have Josephine now come, and she's going to introduce us to stage 3.
So this is stage 3. The patient has so far been on the heparin drip for 3 days now and has been so far therapeutic, and we are starting to prepare the patient for discharge. Lab results, vital signs, temperature 98.7, pulse 75, blood pressure 130/78, oxygen 98%, respiration 19, INR 2.0, PTT 74, decreased pain and swelling. So we see an improvement in this patient due to the lab results. So some of the teachings we're going to give the patient before they go home. Since they are on Coumadin, we're going to teach the patient about Coumadin is a blood thinner. So we make sure we understand and explain to the patient to go and do their lab works done. Take the Coumadin same time every day and try and see their doctor. They need to do exercise, lifestyle changes, do more exercise. And so this is stage 3, and Adam is going to ask the questions.
So now we have had the patient on a heparin drip. He's reached a therapeutic level, understanding the lab work that needs to be done, try to teach the patient what's going on. So what should the nurse emphasize during the teachings of Coumadin blood thinners? Josephine touched on a couple of them. What were some other modifications for his lifestyle that the patient should do?
Diet modification,
Vegetables.
vegetables, and maybe patient needs to avoid a lot of leafy or greeny vegetables.
Okay, so we're going to make sure that he watches his diet. Green leafy vegetables are high risk for bleeding when you're taking blood thinners. Also, maybe brushing with a soft bristle toothbrush, so avoid bleeding from the gums, and shaving with an electric razor, watching for bruising and bleeding, and you would
And
want to
still-
report to the emergency room if anything was to happen, if any high risk factors for bleeding were to happen. Also, we talked about what lifestyle changes the patient can work on. Decrease the sedentary lifestyle, reduce some weight, stop smoking, stop drinking, and diet modifications. So now that we've helped the patient improve, we want to think about what could have been the adverse effects if we didn't catch the DVT. So what are complications of a DVT?
PE.
Pulmonary embolism, that's
Mhm.
correct. So let's look at the answers again. So the first answer was check for signs of bleeding, avoid briefly eating vegetables, and go to a doctor regularly to get your INR PTT checked. Lifestyle changes to decrease sedentary lifestyle, work on his diet, stop smoking, stop drinking, and the answer for stage 3, question 3, pulmonary embolism was the complication of a DVT. It's life-threatening. It is when a blood clot travels from the legs to your lungs and gets trapped in one of your arteries there and cause emergency life changes. So you want to watch out for that. This is what a pulmonary embolism is. The common signs and symptoms. We want them to watch out for this. Report to the emergency room if any of these signs and symptoms happen. Shortness of breath, coughing, blood, sweating, sudden chest pain, apprehension of doom. Feel like your life is going to end. You want to make sure you report to the emergency room immediately. Thank you. This was our project, and I appreciate everybody for attending the class.
Thank you.